Well, we're lucky today to bring What's Up to one of the busier people in our community, Dr. Chip Teel, who has been working very hard with Full Circle America to try and better understand and better take care of our aging population, which is what, 30 million, over 80 now, or something like that?
Pretty close. We are certainly up to 35 million that are over 65, and we're approaching 10 million of those being over 85. So we're getting to the fastest growing population is indeed those that are over 85.
I heard that, and that just astonished me, really.
I think one of the most striking numbers I've seen is that there will be 1 million Americans over age 100 by 2050.
I saw that in your book. Yeah, I noticed that. I've been reading your book, and I must say I found it fascinating. It's called Alone and Invisible. So that has a subtitle, Averting Disaster in Aging America, and I think you point out very clearly with your examples how that disaster is closing in on us. And there's really two factors that come out very clearly. One is the expense of aging America is unsupportable, as I'm sure our governor would be quite happy to agree. And the other is that the regulations are strangling us. And in the person is getting lost. You want to comment on that? I mean, the individuality.
Sure, I think both the money issue is critical, but I think equally important is the loss of a critical part of our community that are no longer visible, valued, appreciated, or just as importantly, an integral part of the community. I think we thought over the last several decades when we were building upscale retirement communities and senior apartments, and to say nothing of all the assisted living facilities, I think we thought we were providing a very fine service for our seniors. And I think what we lost along the way is their need and desire to be an integral part of community, our need and desire to have our elders be a critical part of our community, and the real value of an intergenerational community that we segregated a lot of elders unintentionally.
And when did this start? The 1960s, really?
60s, sure. I think we've, again, as you alluded to at the beginning, this is a brand new problem. So it really is only coming to be a bigger and bigger issue as our population ages and as the demographics of the country are far more slanted to the retired folks rather than the young adult workforce. That's been one of the most dramatic things that we're facing in not only in the economy, but in every part of the job sector, that we have so many more retirees. I think it's pretty soon will be 5 retirees for every working person.
For every person who's supposedly doing Social Security to support them.
Yeah.
Right. Yeah. And then after they retire, I think you used a phrase, something like there's a brief flurry of volunteers, where they join everything and try and help everyone, and then that sort of dies out and they're left with a sort of vacant space in front of them in which they don't really know what to do. And they lose their self-esteem. You make a huge point of that in this book.
I think one of the most remarkable things, in this journey over the last 5 or 6 years has been how hungry many people are for something very, very different. So even though we're seeing tremendous gridlock, in the halls of Congress, when you get out in the communities, there is this tremendous energy to let's go do something like Full Circle America. Let's go put together a new paradigm. There are so many people who want to stay in their own homes. There are so many people who are scared to death of any sorts of institutional care. And their kids are, their adult children, really want what's best for their parents a lot of the time.
Yes, most of the time, I hope.
And they don't really see any choice or options either. you know. And so, you know, one of the insights for me has been watching myself and my medical colleagues grouse about the fact that many older individuals are not taking any initiative proactively to do something, but they're just kind of hanging on by their fingernails, and things are getting worse and worse all the time. You know, and then it hit me, well, if there isn't any really good option other than doing what you're doing, it isn't that irrational to just dig in your heels and just keep doing what you're doing.
Yeah, but the only time you get any real satisfaction is when you're doing something for somebody else. And I think you make that point, and you've numerous case examples of people where when they're asked to help, I think of this Al guy in particular who lives somewhere up in Alma, near the Alma store. Yeah, God, the transformation from when he had that, some kind of a back problem, I think, and was in a nursing home for 10 days or 3 weeks, and he got out and he got motivated again by helping other people who are even worse off than he was.
Well, we've got a tremendous hidden resource in these individuals. When I spoke a couple of springs ago down in a church in New Harbor on a Sunday afternoon, rainy March afternoon, miserable weather.
Maine, in other words.
Yeah. And I think there were a dozen people over age 90 who volunteered to help somebody else. They didn't come to the talk, and they didn't leave the talk saying, I need something for myself.
That's great.
They left saying, what can I do for somebody else?
Yeah, I don't think that's surprising. I think you just have to ask them to say that, and they will. But you have the experience, I don't.
And the neat thing about it is that that helps all the way around. You know, as you mentioned, you get a benefit for doing something for somebody else, and that other person benefits from your help.
That's right.
And we've now been able to document in studies all across the country that it actually is better for your health in very measurable ways. There's less heart disease, you live longer, you have fewer strokes, you manage your chronic diseases better, you have less depression when you volunteer as little as 2 hours a week. All of those things, you can actually document significant improvement in all of those parameters. So we in the healthcare field should actually be insisting that you volunteer because it's in your own health benefit.
Right.
You know, and the older you are, the bigger bang you get for that investment. You know, so it actually, again, because I think most everybody is.
Well, let's volunteer for something you can do, though. Don't drive the lawn tractor for the guy across the street.
Well, that's part of what we're trying to do with Full Circle America here too. Is we're trying to set the bar at a reachable level for everybody. You know, and so the idea of volunteering, in my dad's case, he's got a sunny living room. And if somebody else in the community, can he entertain somebody for a couple of hours, a couple of times a month? How hard is that?
Yeah, really. Might even be fun.
Yeah. We have an older individual with profound dementia. She still loves to sing along with a piano, and she's got a finely tuned piano in her living room.
Well, you have a story in here about somebody who was complaining about the tuning of the piano as they were singing along, and I think they were in their 90s too, or something. She could still hear, apparently.
If you've got a nice view out your window, can somebody share a cup of coffee with you in your kitchen once a month? Those are attainable volunteer efforts that anybody can do.
Now, part of the early part of your book here is pretty hard on our government and our infrastructure.
You kind of like that, don't you?
Got a title, Government Regulation Beyond Reason. I like that. That's arresting. And then you have Chapter 9, which is The State of Maine versus Common Sense. Those are good titles. They make you want to read it. But, you're being, all this about the ADLs, activities of daily living, and minimum data sets, MDSs, where these caregivers apparently have to go through this endless paperwork and checklists and things like that, which really isn't helping anybody very much. It's just a financial responsibility that they have to do.
It's a reporting function, and I think most of us would be aghast to hear that the folks that are caring for our relatives and neighbors are held to doing that kind of scoring. You know, one of the biggest crises we have in healthcare is that people are no longer doing as much direct care. They are filling out these forms.
Right, they're just around the nursing station filling out forms.
And we really need to change that so that actually people can do and get reimbursed for doing direct care, not for filling out the form properly.
Right.
You know.
Or improperly, as the case may be. You were sued, right, at Hodgdon Green?
Yeah, we were.
By the state?
Right. They actually, Elder Care Network, as I point out in there.
And that was a precursor to Full Circle America, or
No, it's
it
an assisted. It's a separate entity. It's a nonprofit that provides a number of assisted living homes and residential care for folks. We have homes in.
You got 7 of them?
7 of them.
Right.
Yeah, scattered around Lincoln County, and there are about 60 people who are all in their 80s and 90s that reside in these homes. And our goal was to create home-like assisted living. Full Circle America is the next phase of things, of trying to create a way for individuals to stay in their own homes.
Stay in their own home rather than assisted living, even. Yeah, one step further removed.
But again, that was quite a fiasco with the state, where we were.
You're on trial.
We were on trial.
Amazing.
Yeah.
That's a great story. Well, you know, great
anyway.
in a sense.
Well, it was, you'd get a kick out of this here. I went to the hearing, the administrative hearing, with our nurse for the home and our executive director and our financial manager. So we all went to try to participate in this hearing, and we got into the room, and it turns out the person that will be interviewing us or
Your adversary.
interrogating
Yeah,
you know, is the Assistant Attorney General.
Yeah.
You know, and the hearing officer says there will, you know, that you'll be allowed to cross-examine the witnesses. You'll be able to call witnesses. There will be opening, closing arguments.
Yeah, and
Are you ready to begin?
You knew none of this when you went in
I
there.
didn't really realize this is
Arguments?
a trial, you know. So I remembered watching Perry Mason as a kid. So that was about my medical training or legal training.
But there's a difference there. He always won and you lost. Yeah, that's a horrible story. Yeah.
But anyway, you know, the whole point of this is that most people want to stay in their own home, and we really have to find a way to do that. And what we're proposing with Chad and Russ and a number of other people's help, you know, is that we need to create a model that can be replicated in every community, and it really shouldn't be that difficult. We are stuck at a position where most people try to nibble around the edges of something, and what we're really advocating and trying to produce is a wholesale change, a dramatic reform, you know. And
so what motivated you to get into this? Graham? You've got some nice words about her in here.
About my Graham, yeah. Well, I think she certainly introduced me to her age group and her friends throughout my life. But actually, I think family medicine and primary care, family practice here in Damascotta, I've been here for 25 years,
right.
And most of my patients have been my inspiration. You know, I've been fortunate enough to hear them
again. You
tell their stories.
You tell that in here.
Yeah.
They're very moving stories. Man.
They have had lots to talk about, and I was lucky enough to be in a position to listen to them.
Well, you talk of the wisdom of elders, you know, which is ignored by the youngsters, and it's true. And you've got your wife interested in now too, Carol. She's over at the Lincoln home, getting them singing and dancing and whatever.
I think
Young
she's
at heart.
She's probably the metaphor for what we're trying to do here. You know, that she, with her Young at Heart performance troupe, she's got individuals that oftentimes are that she's recruited from assisted living homes and other places where you would think that with some mental or physical frailty that they would not be the right people
Yeah.
to put together a performance troupe around.
Right.
But they have really risen to the occasion and it's been a great story.
It has.
I think
it
you ought to
has.
go interview Carol at some point.
We did do a story on them over at the Lincoln home, actually. We
Okay.
interviewed, that was when Dominic was their musical director. Now they've got Sean.
Yeah.
And Carol's been nagging me to do a rerun.
Yeah.
So we'll get to them this spring
Right.
before their performance
Well, that would be great.
at the Lincoln Theater. Yeah. Talk about costs a little bit. I don't think maybe people understand how much it costs to have a mother in a nursing home and taken care of and that sort of thing.
Or who pays for it, you know?
Well, yeah.
You know, I think most of us assume that with the, huge expenses for Medicare, that that most nursing home care is covered. You know, and I think it's a huge sticker shock and realization for people when they actually go to look for residential care for mom or dad, and they find out that a nursing home is about $10,000 a month.
That's the number you have.
And
That was 2 years ago, Chip.
yeah, I know. Well, actually, nursing homes regional, you know, they go from probably as low as 6,000 or 7,000 a month in Mississippi to about 12,000 a month in New York State. You know,
Yeah,
so I think
yeah.
this is an average, but I think what everybody is surprised at is that the only way you qualify for someone to pay for your residential care in a nursing home is after you are destitute, after
Right.
you have
You sign away your assets and then they'll take care of you.
and then
Yeah.
and have spent them down.
Yeah.
And so not only do people not stay in their own homes where they want to, but by default, residential care has become the major option, and that has taken place, over the last 5 or 6 decades. I don't think it was intended. One of the things that fascinated me was learning that some of our first solutions as a society for taking care of elders were poor farms. So when you go down to Bristol and Poor Farm Road and those places.
There's actually such a name?
There is.
Poor Farm Road?
Yeah.
Oh, I'm going to find that one. Yeah.
Yeah.
It's right across from Bristol Mill Storage there.
Okay.
Yeah.
And many communities had such institutions, and as it turned out, there were a lot of people that were poor, that were young orphans or those with developmental disabilities, but an awful lot of them were old. And that
Sure.
was their only problem, is that they were old and they didn't have any family. And so the situation isn't much different now. That if you don't have an extended family around you, one of the major ways that you end up in a residential care facility is not having relatives.
Yeah. Yeah. But with the main approach, it's not $10,000 a month.
No, we've been able to show that with frugal utilization of targeted staff, a lot of volunteers, and a lot of technology, you can actually stay in your own home for anywhere from $400 to $700 a month with around-the-clock supervision, rather than the $5,000 or $10,000 a month of residential care options.
Yeah, that's a bit of a change, isn't it?
Yeah.
Less cost and more satisfaction. It sounds like a winning plan.
You would think so. You would think so, but it's been surprising how hard it has been to not get people who will embrace the idea, but who will fundamentally support change. I've been speaking to government groups and educational institutions and a number of players in the healthcare world for 5 years, and they all say, "Gee, this is great. Down the road, we'll have to think about this."
Yeah.
Right. And what's really hard to get anybody to do is really embrace a sense of urgency. that it's time to get going now.
Well, I should think that would be out there with all the talk of healthcare budgeting and all that sort of thing. The urgency is obvious, but it's not happening. Well, let's talk about the technology, okay? That's why you're here, Chad. Anyway, a lot of the second half of the book here is just a bewildering explanation of the technology that is now available and all the, technology explodes all the time. You probably are running in place trying to keep up with it. I was what was this nanny cam? That was
Sure.
the first thing you put in, right?
Yeah.
Or the granny cam, I think you called it.
Yeah. But what would be easiest for you and the viewers? It may be to do a little show and tell with these things, but basically, I think what we are most interested in conveying to folks is that these are easy to use, off-the-shelf, affordable devices that nobody has to learn any technology
Well,
to
that's
be able to use them.
pretty important because most senior people are really pretty frightened by technology. Even a cell phone is a challenge.
Well, fortunately, these are way easier than cell phones. And most of them are what we call passive technology, meaning that they work whether you do anything or not.
Right, right.
I think
Do you have any issues with privacy with the people you give them to? Because I feel a little nervous being on camera all the time and having my
You?
pill box monitored so that if I took a pill out
I
of it,
thought
you
you'd
know.
like to be on camera all the time. Well, I mean, I think it is similar to when we first had answering machines. None of us liked the way we sounded, on our answering machine, or thought that that was our real voice. And I think when I first started doing this, there were a lot of people that, oh, there's Dr. Teel, he's going to spy on all of us.
Right, the spy
yeah.
aspect of it. Right.
But I think one of the ways that we've diffused a lot of that is really to focus on the fact that this whole thing is a mission about trying to stay in your own home. And we have to use whatever tools. And presented that way, most individuals, if this tool will help me do what I want to do, which is stay in my own home affordably.
Okay, then I'll accept it.
I'll accept it.
With reservations.
And we've also tried to be very aware of people's sensibilities on this. We've found that we can put a camera in your common space. It's in your living room, it's in your kitchen, it's at the places when if I knocked on your door, or the mailman drops off the mail, or someone brings in my groceries, this is the part of the house where these individuals are, and so if most of us don't walk around undressed most of the time, in our living room,
Well, if we're that old, nobody's going to look anyway, so we don't have to worry.
But we're really, and again, the access to these cameras is limited to trained monitors.
Yeah, but they're wireless and they're on the internet, right? You're using.
Everything is encoded and encrypted so that you couldn't
Well, I couldn't.
break this code.
Okay.
I guess if the Department of Defense and Hannaford's can get broken into once in a while, I guess, if there were hackers who wanted to spend all of that time to try to find what my dad looks like, in his living room watching the ball game, more power to them.
Really? Yeah, there must be better ways to spend your time.
But generally, all of this stuff is password and ID protected, and but I think the other side of the plus is really pretty neat because these camera images are web-based. I can access them from my cell phone or my computer at work or my computer at home. So if I'm worried about my dad and I haven't talked with him in a couple of days, and I'm just saying, gee, I'm feeling pretty guilty, I can just go on to my computer at home or at work and see that he's okay.
So he is being monitored, your
He
father.
is. Yeah,
Right.
yeah.
Right. Did he,
Yeah.
which plan did you buy for him, Chip? Never
He's
mind,
been-
you
he's
don't
been-
have to answer that.
He's been my guinea pig from day one, and he freely acknowledges that he plays that role. And when you take my dad as an example, and you show him what his living room looks like on a camera, he says, "Oh, that's pretty harmless."
Yeah. That's good, yeah,
Yeah.
take away his fear. Fear is a big part of being old.
Let me get a couple things for you.
I gotta talk to Chad here too. We've been all the time to come up here and we haven't, just ignoring the poor guy. You're the technology guru for this group?
Well, I help out with the technology. I wouldn't call myself the guru by any means, but that was part of what got me interested in helping out Dr. Teel. The other part is I have aging parents as well.
And you're of course a
and that's
volunteer because you're a
incentive.
selectman in Bristol, I guess it is, isn't
Well,
it?
semi-volunteer, I guess, yeah, something like that.
Well,
But
You violate the thing that you should never forget. Never do a job well, you'll only be asked to do it again.
yeah, but yeah, the technology is part of what interested me in getting involved, as well as the, and again, having aging parents and understanding the difficulties and the challenges that they face.
Are they
and
local?
that we face. They are local. I'm very fortunate.
So you can drive over at least,
I
you
live a
don't
short
totally
ways
rely on
away,
this.
and plus my parents come from a long line of Bristol residents who
Well, there's a lot of Hannahs there.
They've fiercely pushed for living at home.
Good.
and,
Can you describe some of these things, these
Sure.
robots here? these-
yeah, this is
these
a
HALs?
basic, just a web camera, that works over the internet. In some cases, they're hardwired, some cases they're wireless. This is a wireless motion sensor, an infrared motion sensor.
Yeah, where would that be mounted? Is that
we
how you
typically
find out
mount-
if Dad's going to the bathroom during the night or
Yeah,
something like
we
that?
might locate it in a bathroom or a hallway between a bedroom and a bathroom. We might have one in a bedroom as well.
Mhm.
You can put one on a door too, so that if somebody were to leave the house, or someone would have a problem with wandering,
Yeah,
you
a
know,
little dementia problem.
you can even address very fragile people's situations,
Mhm.
in a surprisingly comprehensive way.
Right. We take these devices, a variety of these devices, and we have they're controlled through an internet gateway that gives us access to all of these devices in the home through a single internet port.
Mhm.
And we can program a variety of different functions. Again, we've gone to the extent in some of our experimental cases where we have a motion sensor in the bathroom that will turn on the bedroom light. You open the bedroom
Okay.
door to go out in the living room, it turns on the living room light for you. You go to the bathroom, it turns on the bathroom light, just for experimental purposes to see how far we can take the technology. We don't
And then
typically go to that level, that
You have
extent.
sensors that will find out if the door is locked and all that
Right.
sort of thing.
The other
too.
nice thing, the internet gateway allows us to program an alert similar to like a home security system, where if this motion sensor is triggered, it will send us an email. It's pretty phenomenal in chasing the technology is a challenge, there's no question.
So the things that you
What's the
can
big
do.
gray guy there? Excuse me.
Big gray guy, this is basically a standalone, what's called a Skype phone.
Oh, okay,
Yeah.
sure, I know Skype.
It's
I don't like it, but I know it.
yeah, so it allows you to do video telephone calls, and I think he's gonna try to find somebody that might be willing to talk to him.
So
Cool.
the advantage of that particular device is, as you saw me just doing, it's just a touch screen, so all I have to do is find the picture of the person I want to talk to and tap on their image, and it generates a live video call to that person. So the goal is to make it so that it is accessible to anybody. It is big enough, it's not as big as we would like, but it's big enough to be portable, and we've actually found that we can teach a lot of 85 and 95-year-old individuals to carry on video calls with their
Yeah.
friends and neighbors
I think
with
they
this thing in their lap.
sometimes get addicted to it too, don't they? Just like high school kids with their cell phones?
Absolutely. I think many individuals up front would say, oh, why would I ever use something like that?
Right,
And then once they've used it a couple times, it's something they can't live without.
yeah, amazing.
But like Chad mentioned, there are so many options here that there are remote power supplies. We can actually turn on or turn off a microwave or coffee pot or toaster from somewhere else. You know,
Turn off would be the important guy.
yes. But even in, you know, even in my dad's case, where if the last person in the house, you know, kind of programs the microwave for him for that particular time, I can actually turn that on or off from somewhere else for him so that he, if he doesn't remember to do that. This other thing here,
It's a wristwatch of some
Yeah.
kind, huh?
This
Dick
is
Tracy device.
This is basically a personal alert. This is a wearable device that's tied into your phone system. It's not necessarily a direct line to 911. It can be programmed that way. The way we like to see it used is we have a series of phone numbers that it calls before 911. It can call as many
Yeah.
as four phone numbers.
You don't want to
before
call
dialing
911 unless you really have to. That
But-
leads you right down the path.
This device also allows you to answer your phone. If somebody calls you home, it will ring to this device,
Oh.
and you can carry on a two-way conversation with this device as well. And
You have wrist instruments for taking vital signs and things like that too, don't you?
they exist, and we have used them in a few circumstances. Our focus is trying to pay attention more to the peace of mind, to the non-medical aspects of people's lives, but there are 1 lead EKGs and O2 sat
Yeah,
machines and
right.
pulse oximeters and those kinds of things that you can wear on your wrist and be transmitted cellularly to the cloud somewhere.
I
So
know,
there are
yeah.
such
Ah.
things. But what we're really trying to do is dumb it down to the fact that the biggest issue we have with older individuals is breaking down loneliness and isolation.
Right.
It's not that they don't need their blood pressure checked, but they don't need it checked incessantly. You know, the thing that they really do need, you know, are connections to
Human
community.
contact. Yep.
Human contact.
Yep.
And so what we're trying to
What do you do
focus
about the
on...
touch problem?
Um,
You
well,
got to touch people if you're going to get
you
close
do.
to them.
You
It's
do.
very important.
And that's where the volunteer aspects come in. That's
Mhm.
where asking families to step up to the plate. In other ways, we're asking neighbors to step up, church members. And a lot of these individuals are willing and able to do such things,
Mhm.
but they need a coordinated approach. And so what we're really trying to do is provide a network so that you're not in this alone. You're not burning out by trying to do it all by yourself.
Yeah, there's the burnout factor. Yeah, definitely.
And so,
Just like hospice care or severe burn victims and that sort of thing. There's a burnout factor here.
and even though something like a standalone Skype phone isn't as good as having a visit face-to-face with somebody, as anyone who's used Skype can attest to, it's way better than a telephone. You know, and it really brings you into somebody else's world quite nicely.
Mhm.
Yeah.
Well, I think that's about what we're going to do with you here, and I want to thank you a whole lot. I think the work you're doing is just incredibly important, and we want to get it out and around to our viewers, and I hope it produces some volunteers for you.
Thank you very much,
Yeah,
Kit.
yeah.
Yeah.
Chad, thanks for being
Thank
here.
you.
Yeah.